Good afternoon.
Good afternoon and a very warm welcome to everyone joining us and on the expert chat today. My name is Seerat. I'm a mother to a 3-year-old and a part of the Healofy family. Today, we are here to talk about one more expert chat topic which causes a lot of confusion for all of us parents. The topic is 12 key vaccines for the first 12 months of your baby. Actually, as a mom myself, this was a topic that caused a lot of confusion for me as well. From the family giving me certain names of vaccines, followed by Google, to followed by experts on different platforms to doctors. This definitely is a cause of concern. Keeping all of this in mind, we decided to have this live chat, which will help you solve all your doubts. Now, to understand the importance of vaccination for your kids, the importance of the vaccination card, and to clear your doubts, let me welcome the experts that we have with us on board today. We have with us Dr. Naveen D. Kinney, MBBS MD Pediatrics. He has an experience of 33 years in this field. Dr. Naveen D. Kinney practices at Bangalore. He's the member of the Indian Medical Association and the Indian Academy of Pediatrics. Some of the services provided by the doctor are vaccination, immunization, newborn care, and adolescent medicine. Welcome to the Expert Chat, Dr. It's a pleasure to have you with us.
Thank you.
Next, we have with us Dr. T. Srinidhi. Dr. T. Srinidhi is an MBBS MD pediatrician with almost a decade of experience. He's a pediatrician associated in Hyderabad. He's an expert in solving high-risk situations, putting priority to the health and well-being of infants, managing regular consultation and follow-up. He's also very well-versed with the pediatric infectious diseases, allergies, childhood asthma, infant nutrition, childhood obesity, cardiology, neonatology, and handling some common pediatric emergencies. Thank you so much, Dr. T. Srinidhi, for joining us in the expert chat today.
Good afternoon, very good afternoon, sir, and good afternoon, Seerat, and thanks for this invitation today.
So it's absolutely our pleasure. Let's quickly move on to the first segment of our live chat and let's get started. Now, this year, the theme of the World Immunization Week 2022 is Long Life for All. Dr. Srinidhi, what are your views on this theme?
Immunization is a global health and development success story, saving millions of lives across all ages throughout the year. Vaccines reduce risks of getting a disease by working with your body's natural immune defenses to build protection. When you get a vaccine shot, your immune system responds. We now have vaccines that can prevent up to 20 million life-threatening diseases, helping people of all ages to live longer and also healthier lives. Immunization currently, according to WHO, saves around 3.5 to 5 million deaths every year from common childhood diseases like diphtheria, tetanus, pertussis, to the latest pandemic, as we all know, COVID and other life-threatening infectious diseases. Immunization is a key component of our primary health care, and it's also an indisputable human right of every individual. It's also one of the best health investments that money can buy. And vaccines are also very critical for prevention and control of infectious diseases and also their outbreaks also. And they also help in steaming up the epidemics also, controlling the epidemics also. So the theme is quite apt, that long life for all, and that's through vaccination.
Right, right. Thank you, Dr. Srinidhi, for your views. Dr. Kinney, let's get back to basics now. If you could just enlighten with us with what exactly are vaccines and how exactly do they work?
Thank you, Seerat, and thank you, Healofy, for having me here. as regarding the theme, I think this theme should be for not just this week, it should be for the whole year, the whole decade, and for decades to come. Coming to vaccines, vaccine is something which trains your body to fight against a particular illness. A vaccine is made from a virus or bacteria, which will be in inactivated form, or sometimes from a part of the virus or bacteria, like say for the SARS virus, we have the S1 protein. So this vaccine is injected into our body, and the immune system of the child recognizes this as a foreign particle. And so it develops antibodies against this virus. So in later on, when the child is exposed to the actual virus or bacteria, the immune system immediately recognizes this as something which is harmful to the body. And these antibodies destroy that virus before it can cause the damage to the child or the person. So it's a little more complex than that, but this is basically how vaccines work.
Right, right. Dr. Srinidhi, one question that I've always had in my mind is what has been the contribution of vaccination to humanity? We're just speaking about this while we were getting your views on the World Immunization Week. How do you think vaccination is contributing towards humanity? So are you there with us? Okay. Dr. Kinney, if you could answer this for us, what do you think has been the contribution of vaccination towards humanity?
Like Srinidhi said, vaccination is probably one of the best investments that you can do in the health of the child, and one of the best inventions ever in the history of mankind. The number of lives that vaccines have saved over the years is just not measurable, the value of the vaccines. The classic example is the polio epidemic that we had. When I was a student, we used to see more than 50,000 children having polio, and today for the last 10 years we've not had a single child with polio in our country, and that itself is one of the ways, to tell that vaccines work. As like what we are seeing in this SARS epidemic, people who have been vaccinated are much better off against fighting the virus than people who have not taken the vaccine, as we are seeing in multiple countries. So there is no doubt that vaccination is something which has changed mankind for the good and will continue to do so.
Right, right. Absolutely well said. Dr. Srinidhi, what are your views on the contribution of vaccination towards humanity?
As Naveen sir has just said, the most significant impact of vaccine immunization has been to prevent the morbidity and mortality from all serious infectious diseases, right from birth to almost geriatric age. So immunization is one of the most, as sir said, it should be celebrated throughout the year because it has led to significant fall in mortality and morbidity, and it's saving millions of lives. And it's also improving the quality index of a human being across ages, and especially when concerned with children under 5.
Right, right. Absolutely well said, sir. It is something that should be celebrated throughout the year, not just, something for a week. So, Dr. Kinney, what are the vaccinations that are recommended in the first 12 months of a child's life?
Okay. Will you be playing anything for the benefit of our viewers so
yes,
that we can simplify that?
We'll quickly have our screen shared. Yes.
Yes. So the first vaccine that is given in the newborn period is the BCG, that is the vaccine against tuberculosis, hepatitis B, and the first dose of the oral polio vaccine. In fact, this is one of the few doses of oral polio vaccine that the child will get because India has now shifted over to the injectable polio vaccine. And then when the child is 6 weeks old, that is at 1.5 months, the child will receive DTaP or DTWP, depending on what they choose. DTaP is the slightly less pain version of the DTWP. The hepatitis B, the HIB vaccine, the injectable polio vaccine, the PCV or the pneumococcal vaccine, and the rotavirus vaccine. And these 6 vaccines are repeated 3 times. So that will be at 6 weeks, at 10 weeks, and at 14 weeks. And then we come to this 6 months vaccination. That will be the influenza vaccine and the typhoid conjugate vaccine. The influenza vaccine is given in 2 doses at 6 and 7 months. And then we come to the 9th month. 9th month, we will have the meningococcal vaccine, the ACWY, first dose of that. The MMR, that is measles, mumps and rubella. And yellow fever is just an optional vaccine for people who are traveling to other countries. But in some countries, it is mandatory. But in India, it is only a traveler vaccine. So there are also at 12 months, we have the hepatitis A and in certain required cases, the cholera vaccine. But this basically is what we administer to our children in the first year of life.
Right, right. Parents, here I would also want to highlight about the digital vaccination tracker, which is available at My Vaccination Hub powered by GSK. A digital vaccination tracker will help keep record of all the due and missed vaccination along with timely reminders. As parents, we do understand how important this is. So parents, you can now go to myvaccinationhub.co.in to register and receive timely reminders so that you don't miss a single dose of vaccination. My Vaccination Hub is a one-stop solution for all the vaccination related information. Please make a note of that. Now, moving ahead with our session, Dr. Srinidhi, according to you, what are some pre-vaccination care tips that parents should follow?
I would just here talk about certain simple tips which parents can follow to support their child prior to vaccination and during immunization. First, the parents can do their research. The first thing is that they need to have their immunization schedule with it, and they can do their own research about the vaccination that they are going to get, read about it briefly, and then they can discuss with their family pediatrician prior to vaccination. And the second step, they can carry a sweet solution or sucrose, because tasting something sweet can reduce the little one's pain slightly. And for young infants, sometimes if possible, they can breastfeed, because while feeding, the baby is calm and also in a calm mode and can be pacified easily. And then nowadays you have in the market, you can ask for a pain relieving spray also, which blocks the pain signals from the skin prior to vaccination. And for little older children, the parents can have a one-to-one talk with them prior to vaccination, allay their fears, and just talk, like saying it would be just like a small pinch or a small shot. And during vaccination also, they can just talk to them, distract them. And for little ones, I mean, they can play their favorite video or a rhyme or a lullaby. And big kids, I mean, especially with big kids, especially, they need to be talked to, and their anxieties need to be allayed. And sometimes they can talk to the pediatrician prior to your next vaccination. They can talk to their pediatrician one-to-one about the vaccination per se. These are the few tips which parents can always have in hand prior to vaccination.
Yes.
If I can add a few things, Seerat.
Yes, sir, please.
One tip I can give children, give parents is, please don't use your doctor as a tool to make your child eat. The common thing I hear is, if you don't eat, I will take you to doctor and give you injection. The doctor immediately becomes a villain in the child's mind. And, the moment he enters the clinic, he's going to start screaming. The second thing is, be honest with the child. You don't tell him that I'm going to take you for an ice cream and then bring him for an injection. The child will never believe you again in his life. So be very truthful. Tell him that this is something that you're going to get for your own good. It's going to hurt a little, but after that, maybe you can give him the incentive of the ice cream, but don't fool him into coming into our clinics.
Very
Absolutely.
well said, doctor. I'm sure these tips are going to
And
come
also
very handy. Yes, sir.
And Seerat, many times we see in our office practice, most of the time the parents are so much scared or rather than the child. So sometimes the parents themselves need to be prepared for the vaccine shot visit. They can be cheerful and be little more relaxed because many times the parents are more scared and ultimately the kid also gets scared.
Good
Very
point.
true. Very true. Good points. Great points. I am sure these points are going to come very handy to our audience when they take their children for their next vaccination. Thank you. Sir, I cannot insist enough on the importance of timely vaccination. But Dr. Kinney, could you again just put light on how important is timely vaccination?
Yeah, see, we give vaccines to prevent that illness. Vaccines have very little value once the child gets the illness. So each immunization schedule of a particular country is tailored based on the prevalent diseases in that country and the chance of that child getting that illness. So certain vaccines are given before 6 months, certain vaccines are given between 6 and 12 months, and so on. So it is imperative that you give the vaccines to your child at the correct time. But if you have by chance missed the vaccine, give it as early as possible so that the child gets the benefit of the vaccination and is prepared to face society with a little bit of immunity. Preferably, all vaccines should be done before the age of 2. So that, because that's when the child starts going out into society, to school and social gatherings, etc. So child should have some immunity by then.
Right, sir. Right. Dr. Srinidhi, my question to you is that we moms face this quite often. What should a parent do in case they miss any scheduled vaccination?
I mean, as Sir said, it's always better to keep a tab, and as you said just now, to keep reminder tracks and all. But if you skip a vaccine for some reason, it's always best thing to do is get it as early as possible. And you can always talk to your pediatrician about when they can take their next shot. For example, there are some vaccines like rotaviral vaccine which need to be taken before 6 months. So, and there are certain vaccines you can, catch up vaccines which you can take. Like, for example, influenza vaccine you can take at any time. So by and large, you can always talk to your pediatrician and get the next vaccine shot as early as possible.
Also, if you miss a particular dose, there's no need to repeat the whole schedule again. You just have to take the doses that you have missed. Suppose it's a 3-dose vaccine and you've taken the first dose and you missed the second dose, or you've taken 2 doses and missed the third dose. You need not take all 3 doses again. You just need to take the last dose, the dose which you have missed.
Right. Dr. Kinney, what exactly is a vaccination card? Why is it important? And in case if it's lost, what is it that should be done?
See, vaccination card is, I would say, almost as important as your passport, because it contains all the details of whatever vaccine has been given from childhood. And of late, I am seeing that this kind of immunization record is being insisted by even universities when the child is 15, 18, 21 years old. And I'm seeing parents struggling to find their immunization cards. So I would suggest that you keep all your cards carefully and see that every vaccine is entered in the card. Sometimes we doctors are busy, we just scribble something in our prescription and forget to enter it into the card. So make sure that your doctor enters every vaccine along with the sticker, if possible, in the vaccination card, and keep these vaccination cards carefully because they are as important as a passport.
Right. And so just in case if the vaccination card is not with the parent and the child is slightly older, how should a child go forward? Should the vaccination card be maintained from that particular age onwards, or how should that be taken care of?
Yes, of course. We can always give them another card. especially in my practice, I have a digital record of all vaccinations, so I can always give them. But at the same time, I'd like to stress that don't be in a hurry to get a second card, because most of the time they find it after 3 months. So you'll end up with two cards. So they'll have kept very carefully and forgotten about it. And they suddenly come across it. And I have so many patients coming with 2 cards, sometimes even 3 cards. So don't be in a hurry to get the alternate card. Just search for it carefully.
Right. Dr. Srinidhi, based on my experience as a mother myself, parents are really skeptical about giving multiple vaccinations to their children. Are there any other options available?
I mean, there are many new vaccines where you have combined vaccines. For example, you have combined vaccines for MMR and varicella. Put together, you have combination vaccines. So you can talk to your pediatrician and go for these combination vaccines. Thereby, you can decrease one shot.
Right.
And similarly, at 6, 10, 14, as said, we have combination vaccines right now, where you can give all the 6 vaccinations together in one shot.
Right.
With DPT and HIP and hepatitis B, and also injectable polio vaccine. So thereby you are preventing 2 shots less.
Right. Dr. Kinney, let's talk about combination vaccines in detail. I mean, what are the diseases that these combination vaccines help protect the baby from, and the benefits of the combination vaccines that are available?
So the common combination vaccines we have are the 6-in-1 vaccines and the MMR vaccine. That is the 2 common vaccines that we give in the first year of life. The 6-in-1 vaccine contains a vaccine called DTP, which is against diphtheria, which is a very severe respiratory infection, tetanus, which everybody knows, and pertussis or whooping cough. It contains the injectable polio vaccine, which now, like I said, is now the replacement to the oral polio vaccine. We then have what is called the HIP vaccine, or the Haemophilus influenza B, which is a bacteria which causes severe meningitis and ear infection in children. We have hepatitis B is the 6th component. Hepatitis B is a severe infection of the lungs, of the liver, I'm sorry. So this 6-in-1 vaccine is available. There is also another one which contains the less pain version of DTP called DTAP, with the other rest of the vaccines remaining the same. The other combination vaccine is the MMR, which is the measles, mumps, and rubella together as one. We used to have MMRV, that is measles, mumps, rubella, and varicella or chickenpox, but it no longer is available in India at present. And coming to the advantages of combination vaccine, number 1, less pricks for the child. Number 2, less doctor visits. So parents don't have to take off from work that often. And the advantage of the vaccination schedule getting over sooner than if you had to give 6 different vaccines to a child. It would have been much more unpleasant to the child. And then, like when I started practice, we had to give it separately. There was no combination vaccine available then. So I've seen the advantages that combination vaccines have given me in my practice.
Right. Sounds really heavy. My question, sir, to Dr. Srinidhi here is, parents are really concerned about an overload of antigens, on the baby's immune system with combination vaccines. What are your opinion on this, sir?
It's a myth. I mean, it's not that your kid, when he gets, for example, he gets a combination 6 vaccines together, he gets a vaccine which is a combination of 6 components. It's not that he'll be overloaded with the antigens. The amount of antigens would be the same as prescribed. And all these vaccines are time tested, and they have come to different trials, and many have been, for example, DPT vaccine, probably it's been given since more than 50 years now. And all these combinations we have been giving from so many years. So, and they are quite safe. So that the possibility of overload of antigens doesn't arise?
If I can answer this question too,
Yeah, please, sir.
Apart from the vaccines that the child gets, even otherwise, on a daily basis, a child is exposed to around close to 2,000 to 6,000 different antigens in a day. And over a lifetime, I just read up yesterday that the human body can produce unique antibodies to more than 1 quintillion antigens. 1 quintillion is 10 to the power of 18. And it can have 1 quintillion different antibodies and still recognize it next time you're invaded by that. So I don't think, see, in the course of 2 years of vaccination, the child will be exposed to about 250 to 300 antigens from things. So 300 antigens out of this many quintillion, I don't think is going to make much of a chance, much of a difference to the child's immunity.
Right. But doctor, with up to 6 vaccine antigens being combined into one, I'm sure there may be certain side effects.
See, thankfully, the side effects are due to the one component, that is the DPT, which is the one which causes the fever and pain. So whether you give DPT separately or as a combination, the side effect in our experience has not been much. Of course, some children react a little more violently to the DPT. So to them, we offer the DTAP as the next 2 doses. But otherwise, by and large, most combination vaccines cause as much or as less fever as the individual vaccines.
Right. Okay.
And I think there's no major, Seerat, there's no major difference, as sir said, in a single vaccine causing less pain and a combination vaccine causing more pain or more reaction.
Right. Dr. Srinidhi, like you mentioned pre-vaccine tips to us, could you also share certain post-vaccination care tips that parents can follow for a seamless vaccination experience?
I mean, again, to make things easy, post-vaccination, I mean, if the parents are aware of the vaccine that is due for their kid, they can read what are the common side effects. Most of them are common is a sort of redness and small slight swelling over the injection site, can be relieved by applying a soothing cloth or can be applied ice over it, or a hot fermentation can help. And for certain vaccines, if they have a lot of pain or mild fever, it can be relieved by giving simple paracetamol, which you can ask your pediatrician. And yeah.
Right. Thank you so much, Dr. Kinney and Dr. Srinidhi, for helping clear our doubts. It was an extremely insightful session. As a parent, I can say this. We have certain questions from the audience for you both doctors. I'm just going to take it one by one. The first question that I have is for Dr. Srinidhi. This is from Priya. She's from Gujarat. She says, for kids, there are too many vaccines these days. In your opinion, are all the vaccines important?
Good afternoon, Priya. Actually, most of the vaccines are, they are approved through a panel with the Indian Academy of Pediatrics and also through the central bodies. So most of these vaccines that are there for under 2 years, all are important and all are of top priority. And it's always better to take the vaccine than not to take. Since prevention is better than cure.
Right.
So most of these are very important vaccinations, and they cover against all the major infectious diseases that the kids face in first 2 years of life, be it polio or diphtheria, measles, mumps, chicken pox, which you see quite often during this time. We have seen a lot of, for example, with chicken pox example, varicella infection, many think it's a disease. If it comes naturally, it's good. But we have seen many cases landing up in varicella encephalitis. That is a complication of varicella infection leading to brain infection. So vaccination is always better to be taken than not to take. And if you have any queries, Priya, you can always talk to your pediatrician in detail, one-to-one, and then go for your vaccine.
Right, right. Dr. Kinney, the next question is for you. Shreya from Hyderabad has asked, every doctor suggests different vaccines. Which, according to you, are the must-have vaccines?
Yeah. Thanks, Neha. That's a nice question. I can understand your confusion. I'm sure many parents are in the same boat. The variation in the vaccine recommendation is mainly between the government sector and the private sector. I think all doctors in the private sector are on the same page, but the government suggests a few lesser vaccines, mainly because of cost constraints, not because they aren't very effective vaccines, because the most of the vaccines are quite expensive, and the government can't afford to give all the vaccines to all the children. But that said, I would say all the vaccines are worth giving, because statistics have no meaning. Even if it's 1 in a 10,000 incidence of illness, that one might be unfortunately you. So if you can protect yourself from a disease by taking a vaccine, and if that vaccine is proven to be safe, I don't see any reason why you should not have that vaccine if price is not a constraint. So the only constraint should be the price. Price is not a constraint. I have given my children whatever vaccines were available when they were small. I wish there were more vaccines then, but they weren't. But whatever vaccines were there, I have given them.
Right, right. Thank you, sir. Next question we have here is for Dr. Srinidhi. So this is from Jaya. She's from Mumbai. She says, are there any substitutes to vaccines?
There's no, unfortunately, there are no substitutes to vaccination. I think Jaya has been asking whether there is any, she was relating to all the herbal things or immune boosting foods or fruits or spices and all that. But all those are no match to immunization or vaccines. There are no substitute to vaccination. Vaccination it should be, in my opinion, though I might be little harsh, but it should be compulsory in a country like us. Like we have been able to almost eradicate polio only through immunization.
Right.
So there is no substitute or alternative for vaccination.
The only substitute to vaccination is getting the disease. Then you're immune, but it's not worth that risk.
Right.
Absolutely.
Right, right. Dr. Kinney, we have Latha here from Kerala. She says she stays in Kerala, but for the first 6 months, I was in Chennai as my husband is from Army. Can I give the rest of the vaccines in Kerala?
Definitely, Latha. The vaccination schedule is commonly followed all over the country. So you can go to any part of the country and get the vaccines. A few vaccines may not be available in the peripheries. And in my experience, Kerala, the vaccine availability in Kerala is a little lower than other parts of the country. So you'll have to probably go to a private sector and ask specifically for that vaccine. You may not get it in most of the hospitals in Kerala, but in the bigger cities, you definitely will get all the vaccines, and you can continue from where you left off in Chennai.
Right, right. Dr. Srinidhi, we have the next question for you. Padma from Chhattisgarh has asked, are there any side effects of these vaccines?
Side effects for most of the vaccines are, there might be a mild redness, induration and swelling at the vaccine site. And for some vaccines like DPT and all, you can have high-grade fever, and some babies might be more cranky, for which simple paracetamol and, as I said before, applying ice cool packs over the swelling can soothe the baby. And you can always report any major side effect occurs through the websites which they have for the vaccines. Right. And in general, most of us would would have got vaccinated for COVID. So more or less side effects are very few, and it is quite safe to take almost all the vaccinations.
Right, right. Doctors, we have questions coming from parents from across India. I'm going to pick up questions which have not been answered previously. So, Dr. Kinney, the next question here is for you from Deepa. She's from Noida. She says, are these vaccinations available in government hospitals?
To a certain extent, yes. The government is doing an excellent job. It has been doing for all these years. The universal immunization program is a runaway success. Of late, many states have also introduced the pneumococcal vaccine and the rotavirus vaccine. So the first three vaccines, that is the 6-week, 10-week, and the 14-week vaccine, is available in most government hospitals. Unfortunately, they haven't introduced few of the vaccines which we give in the private sector. So the influenza vaccine, the chickenpox vaccine, the hepatitis A vaccine, the typhoid vaccine, etc., is not available in the government sector. So you will have to get that from the private sector. But even the vaccines given in the government hospital are good. And if you have an opportunity, you can save some money by getting it done at the government hospitals too.
Right, right. Dr. Srinidhi, Natasha from Goa is asking, what is combination vaccines? Had heard from a mom that her doctor had suggested it.
Combination vaccines we have right now are at 6, 10 and 14 weeks, as Naveen sir just said. You have a combination vaccine wherein it is protected against diphtheria, pertussis, tetanus, Haemophilus influenza, and hepatitis B, and also IPV. Altogether, you have a hexavalent vaccine is there. And again, at 9 months, you have a vaccine which covers measles, mumps, and rubella. And the other one where combination vaccine of MMR and varicella, right now it's not available in India as of now. Previously it was there.
Right.
And the rest of the vaccination you have, it comes as a solo this thing. You need to take one at a time.
One at a time. Right, right. Dr. Kinney, Janice from Goa is asking, I normally hear from my friends that they miss the vaccine date. What are the side effects of missing the date? So also one question I wanted to ask you was, so for example, you know that you're going to be traveling on the date of the vaccination. Can you take the vaccination prior to the time given by the doctor?
Good question, Seerat. Good question, Janice too. Side effects of missing the vaccine is, of course, if you're unlucky, you'll get the disease. So before you get the disease, you get the vaccine. Get the vaccine done. But that said, once you miss the vaccine, get it done as early as possible so that your child's immunity is boosted by the second dose. Regarding your question, Seerat, you can get the vaccine done early provided it is not the same vaccine. Between 2 doses of the same vaccine, so if you're taking 2 doses of DPT, there has to be a minimum gap of 28 days, preferably 30 days. But if it's 2 different vaccines, then you can get it done earlier. But again, doses the duration between 2 live vaccines, say MMR and chickenpox, should always be 28 days. You cannot have 2 live vaccines given in a shorter span. But killed vaccines, you can have a shorter gap between the 2 vaccines. But preferably stick to the date so that there's no confusion.
Right, right. Thank you, sir. Dr. Srinidhi, Pradnya from Pune has asked, during COVID in last 2 years, most of the doctors were shut and many parents were unable to give vaccines. What happens in this case?
Yeah, I think, Pragya, this is a very good question. Many of the parents had faced this situation. So they can get the vaccinations, they can get the catch-up vaccination as soon as possible. Like, for example, few of the vaccines cannot be given, like rotaviral vaccine. If it has been missed, they cannot take it. But rest of the vaccinations, they can take it as soon as possible. By maybe 1 year, they can schedule it accordingly by discussing with their family pediatrician and getting it done one after the other before 3 years of age.
Right, right.
I'd like to come in here and say that even unimmunized children who are even 5, 6 years old can still take the vaccines and benefit from the vaccination. It doesn't mean that it has to be given only in infancy. You can take it anytime throughout your life if you have not been immunized earlier.
Right, right. Dr. Kinney, the next question is for you. Maya from UP is asking, is it okay to give vaccines to kids who have cold or fever?
Cold, maybe yes. Fever, I would try and postpone because we will not know whether the fever has increased because of the vaccine or because of the disease per se. So if the child has a mild cold and otherwise comfortable, I would go ahead and give the vaccine. But if the child has fever, you can easily wait for a week and get it done after the child is better.
Right, right. Dr. Srinidhi, I think this, okay. We have a couple of more questions coming, last few questions coming your way now. So this is Shela from Jaipur. She's asked, what is painless vaccine and how is it different?
Yeah, hi Shaila. Painless vaccine is, I think, what she's referring to is the acellular vaccine component of DPT. DPT whole cell vaccine, which is generally given at 6, 10, 14 weeks, causes a lot of, in some children, causes a lot of pain, swelling, and fever. And in some babies, it can cause excessive crying and all that. In that case, you can always opt for a acellular version of DPT vaccine, which causes relatively less pain, fever, and also swelling. So you can painless vaccine basically is the acellular vaccine, that is DTAP.
Right.
I would like to stress here that there is no painless vaccine. It is a less pain vaccine. All vaccines pain when the injection is given, but the after effect of the vaccine. Many people question me, you said painless, my child is crying. The child is crying because of the injection. The reaction comes later and the reaction is less in a less pain vaccine.
Right. Dr. Kinney, Madhu from Mumbai is asking, is vaccination mandatory after every fever?
I'm not sure I understand her question. There is no vaccine which is mandatory after every fever. But after a fever, after a particular time, you can go back to the child's immunization schedule, see if any vaccines are missed and get it done.
Right, right. So next question is for Dr. Srinidhi. Priya from Mumbai has asked, does heredity affect children's immunity?
Until, as sir said, per se no, because if you get the if you are not lucky enough, if you get the natural infection, there's no way you are going to prevent. For example, polio, you cannot prevent. So per se, it won't.
If you're talking about hereditary and hereditary illnesses, there is a category of illness wherein the child is immunocompromised, and that immunocompromised condition can be inherited. So there are certain children who inherit that stage of immunocompromise, and such children are always prone to infections. But thankfully, it's a very rare condition. It's not very common.
Right, right. Dr. Kinney, heard this one a lot during COVID. So Manisha from Mumbai is asking, does getting a fever after vaccination means it is effective?
Yes, that's a very good question and a very big myth around. It need not cause any reaction. It does not mean that if the child does not get fever, that the vaccine is not effective. It depends on the reactogenicity of the vaccine and the reaction of the child. Some children, I have children who have never had a fever throughout their whole childhood after vaccination, whereas some children get fever with every vaccine, but all of them are equally protected.
Right, right. Dr. Srinidhi, next question we have here from Meenakshi. She's from Jaipur. Should premature babies be vaccinated after a delay, or can they be vaccinated immediately after birth?
Premature babies can be vaccinated once, for example, For BCG vaccination, I think once they are 2 kgs, about 2 kgs, they can be vaccinated. And generally, for preterm babies, the vaccination schedule it would start from the corrected age gestation. Accordingly, the vaccination schedule can be charted and can be given quite safely in all premature babies.
Right. Dr. Kinney Sudha Rajgopalan from Tamil Nadu is asking, if we take the polio injections as per schedule, do you need to worry if you miss the polio drops offered by the government?
That's a very good question, a very important question. Let me try and explain. You give your child the polio drops to protect your child against polio. You give your child the polio drops during the government pulse polio immunization to make sure that your grandchild lives in a country free of polio. You are taking part in the national polio eradication program to see that the future generations do not suffer from this disease. So even if your child is already protected against polio by the injections that you have given the child, you still have to take the child to the immunization center, and particularly during that week. That week is when we flood the community with the vaccine virus. The disease-causing virus has no place to survive, and so it dies out. That is how the pulse polio immunization has been a success in our country, and it is now rated as one of the greatest healthcare achievements ever in the history of mankind. I never dreamt when I was a student that I will see my country free of polio, but the last 10 years we've not had a single case of polio. But still the battle is not won, because our neighbors Pakistan and Afghanistan still have polio, and it's so easy to import the virus from there. So till we are sure that the whole world does not have the polio virus, we have to give our children less than 5 years the polio drops on those pulse immunization days.
Right. Thank you, sir. Dr. Srinidhi Mansi from Jaipur has asked, what is baby vaccination chart? Where can I track my baby vaccination?
Basically, vaccination chart is available in the private sector. You can get a vaccination schedule chart from your regular pediatrician. And also in all PHCs, you have a government scheduled you have a vaccination chart even in a primary health center also, wherein the vaccination chart would be there where you can chart it out. And regarding the second question, you can track your child's vaccination these days with quite a few good apps are there around, wherein you can track your vaccination, and it also gives a reminder when your next vaccination is.
Our Indian Academy of Pediatrics has a vaccine charting app, so you can just search for that on the App Store.
Right. Dr. Kinney, Preeti from Pune is asking, government vaccination or private vaccination, which one is better, in the sense which one is of good quality?
See, they're basically the same. The suppliers are the same. We don't have much choice as far as manufacturers are concerned. The only probable thing that you'll have to ensure is the sterility of the process of vaccination. So make sure that they sterilize the site properly. They use a disposable syringe. The minor disadvantage that I would point out is that in the government setup, it is the vaccine is taken from a multi-dose vial. So that vaccine is shared between 4 or 5 children, whereas in the private sector, it's a single dose vaccine. That said, with proper precautions, with proper sterilization, the government is doing an excellent job, and you can safely get all your vaccines from the government sector.
Right. Dr. Srinidhi, Pooja from Delhi is asking, how do you prevent children from getting seasonal flu?
Yeah, Pooja, for prevention of seasonal flu, you can give a vaccine shot of influenza vaccine, one at 6 months of age, and the second dose you can give after 1 month, that is at 7th month. And thereupon you can give annually every year single dose of flu vaccine can be given annually every year.
So and, sorry, please go on.
Yeah, sir, go on.
Yeah, so parents should realize that this virus is a very smart virus, the influenza virus. It's probably smarter than even the COVID virus, and it changes itself so often that the vaccine has to be made every year. Because by the time the year is over, the vaccine will have changed itself, the newer variant will have come, just like what our COVID is doing. So influenza vaccine also is needed every year. And I won't be surprised if the COVID vaccine has also made an annual vaccination because of the COVID virus changing itself so often.
Right, right. So Pooja has again added to the chat. She says, I would like to ask, is flu vaccine important even after the age of 5 years?
I'm taking the vaccine.
Oh,
yeah.
So
Even I do.
All taking it every year.
10 years.
So it has to be taken. Some protection is better than having no protection.
Right, right, right. Dr. Kini, Pallavi from Delhi is asking, are the booster dose vaccination important too?
Very important question. Very important to take booster doses, because over a period of time, the immunity that has been generated by the primary doses tends to wane. What the booster dose does is to suddenly boost up the immunity, so that in future also, if the child is exposed to the bacteria or virus causing the disease, the child is immune. So booster doses have to be taken. A proper example I can give is that the Western world took it a little easy with the taking the boosters of the DTaP vaccination, and so many developed countries are seeing an outbreak of pertussis, that is whooping cough. So after they have started giving the boosters, the incidence of this illness has come down.
Right. Thank you, sir. That was our last question. And with this, we conclude our session for the day. Thank you, Dr. Kini and Dr. Srinidhi, for helping us clear our doubts and showcasing the importance of timely vaccinations, explaining which are the must-have vaccines and its importance. Generally, we as moms, we do everything to keep our children healthy and protected. We go out of the way to get them the right products, but we are never always 100% sure of the vaccines and its importance. So a big thank you to you from me and all the parents who are listening to this expert chat session today. Thank you for showcasing the importance of vaccination. I'm very sure our lovely audience will keep a tab on the vaccination card and give their children timely dose of what's due and when it is due. To the audience here, if you have any further questions, you can drop them in the comment section. We'll try and get them answered for you by the doctors. Thank you, doctors, for being a part of our session, enlightening our parents on such a crucial topic, which is so important for every child's growth, development, and health. On behalf of our entire audience and Healofy team, I thank you once again for giving us your time. Thank you.
Thank you for having us here.
Our pleasure.
Thank you, Seerat. Thank you, Healofy. Thank you.